is Dr. Allan F. Thornton. I'm a radiation oncologist. I've been practicing proton therapy for 27 years. On behalf of SAH Healthcare, it's my pleasure to participate in the workshop today at Arab Health. So this is a workshop that we've been performing on, SAH Healthcare has been putting on here at Arab Health, and we found this to be very successful in introducing people to proton therapy, but actually drilling down in more particular to the physics, the history, the technology, and the applications of the proton therapy on a clinical basis. Oh, well, this is a wonderful forum that is a huge conference, much larger than I've been in the United States. It brings together many disciplines, and we found many useful contacts that have been made. Many folks from around the whole part of the world have come here to learn about proton therapy, learn about the construction of the facilities and its applications. This would not be possible without such a forum as Arab Health bringing this together. Well, proton therapy is a field that has actually been used since 1961, so it's not a new technology at all, but it's evolving to become a mainstay of radiation oncology. It does so by treating 70% less normal tissue than any other conventional therapy would provide. And so it's becoming the mainstay of treating the visible tumor, the residual tumor after surgery, particularly for children, lung patients, breast patients, brain tumor patients.